Hello everyone, welcome to the HSVMA Continuing Education webinar series. Thank you so much for joining us. I'm Lorna Grandy and I'll be your moderator tonight. We are excited to bring you this special series with Dr. Melinda Merck on reporting suspected animal abuse. Before we get started, I want to go over a little bit of housekeeping. All attendees are muted tonight so that we won't be listening to each other's critters in the background all evening. If we do have any technical difficulties, we hope you'll be patient because we will try to resolve them as quickly as possible. You will probably have a better listening experience if you close out all other programs on your computer. But if you do have trouble with the reception on this live broadcast, as always, this webinar is being recorded and will be archived for you to listen to later. Before we get started with tonight's webinar, I'd like to tell you a little bit about HSVMA. The Humane Society Veterinary Medical Association is a national association for veterinarians and veterinary technicians founded in 2008. Our focus is on animal health and welfare. These photos are from some of our programs. HSVMA provides a forum for veterinary professionals to advocate, educate, and serve. Animal advocacy consists of activities such as working on legislation and educating the public about animal protection issues. HSVMA educates veterinary students and provides CE such as this webinar and many in-person programs. HSVMA also promotes humane teaching methods in veterinary education. Several veterinary schools have HSVMA chapters, and we provide suture labs and other education programs to those student members at no charge. One of the service programs that we provide is RAVS, Rural Area Veterinary Services. RAV staff and volunteers work in rural areas where the community is often underserved, providing millions of dollars of veterinary care to families and their pets at no charge. And you can earn continuing education credit by volunteering with RAVs. So get in touch with HSVMA to learn more if you're at all interested in that. So before we get started, I just want to also let you know that a copy of the presentation is not going to be available this evening, but you can access the archived version on demand at any time, and we will email links to forms and handouts from the presentation later this evening. And we really welcome your questions. So if you have any questions, please type them into the questions section of your control panel, and we will get to as many of them as possible by the end of the presentation. So I'm really proud to introduce tonight's speaker. Dr. Melinda Merck is a graduate of Michigan State University College of Veterinary Medicine. She is the founding chair of the Board of Directors for the International Veterinary Forensic Scientists Association and fellow of the American Academy of Forensic Science. Through her business, Veterinary Forensics Consulting in Austin, Texas, she assists investigators of animal cruelty with crime scene investigations, examination of live and deceased victims, frequently testifying as a veterinary forensics expert. Dr. Merck provides training for veterinary, attorney, and law enforcement professionals internationally on the use of veterinary forensic science in the investigation and prosecution of animal cruelty cases. She is the president-elect of the Board of Directors for NAVC and program chair for the Veterinary Forensics Animal CSI track. Dr. Merck is the author of the textbook Veterinary Forensics, Animal Cruelty Investigation, and co-author of Veterinary Forensic Investigations of Animal Cruelty, a guide for veterinarians and law enforcement, and a contributing author on forensics for several additional publications. She is series editor of Forensic Cases for Clinicians Brief and a contributing author for NAVC Vetfolio Forensics and Animal Welfare. Dr. Merck is the course director and instructor for the Vetfolio Online Veterinary Forensic Science and Medicine and Animal CSI certificate courses. She developed the first veterinary forensics course for University of Florida and Georgia veterinary schools and frequently lectures at other veterinary and veterinary technician colleges. HSVMA is proud to have Dr. Merck present this important three-part series for us, so please help me welcome Dr. Melinda Merck. Take it away, Dr. Merck.
Thank you, Lorna, and thank you everyone for being here tonight and signing up for these courses. This is, I think, one of the most important series. I was really excited to ask for me to do these series because of not ever having a platform to spend the time to really go through the different issues that we face as veterinarians, in what we're expected to do or what we should do, and when we're faced with suspected abuse cases. So by way of background, just to make you aware that I was a practice owner, had a practice in Atlanta, so I've dealt with cruelty cases as a practice owner. I've dealt with cruelty cases as an associate veterinarian. I've also worked with shelters and rescue organizations in addition to working with national organizations. So I'm going to try to bring in all that experience and look forward to your questions. So the first question when you see a case of animal abuse, when you suspect abuse or neglect, when do you report it? And what is the purpose of reporting? So when do you report is as soon as you suspect. Notice it's not about proving animal cruelty before you report. It's about suspicion. Sometimes it's obvious and you know right away, but sometimes it's just about suspicion. And we're going to go a lot more into detail about that. And then this is where I think we get hung up. It's what's the purpose of reporting? The purpose of reporting is to not have the client arrested and handcuffed on the front doorstep of your practice. The purpose of reporting is to initiate an investigation, right? So that's the purpose. We don't know all the parameters and things that could be going on. We'll discuss more about it, but there's animal cruelty can be the first line, the first sign of something else going on in that home. So the sources of potential abuse case can come from a variety of sources. It can be from your client. It could be a new client, an old client. That person could be the owner of the animal or someone with access to the pet. Client involvement can be where the child is a suspected perpetrator of the cruelty. They may come in as a good Samaritan. Someone found an animal, and they may or may not be a client. Cruelty investigators can bring you a case. This can be from all different jurisdictions, so it can be animal services or law enforcement. And then rescue organizations may get a case in, whether they've taken it in or it's a door dump. So those can be the variety of sources of abuse. Emergency hospitals deserve some special considerations that I'm going to touch on here and again next week. So they can see cruelty cases a lot more than the general day practices. And this can be due to the client wanting to avoid going to their regular veterinarian, especially in domestic violence cases or in cases involving potentially illegal drugs. Also, it's at the end of the client workday, so there's a discovery time at the end when your day practices have closed of the issues with their pet. And then late night and weekends with emergency hospitals, we know there's a higher use of drug and alcohol consumption, so that can lend itself to more either intentional or accidental exposures to abuse or and when I say accidental, it's still putting the animal in an unsafe environment if they are ingesting these substances. There's also, for emergency hospitals, the issues they can have is a lack of knowledge of that patient and the client history. So it makes it very difficult for them to assess, but it also makes them extremely skilled at knowing accidental versus non-accidental. And the rapid pace of emergency hospital can make determination of accidental versus non-accidental difficult, right? Because everything's going so fast, the key suspicion indicators can be lost. So we're going to go with our first poll question. So hopefully you can all see it on your screen. Is, have you seen a suspected case of abuse in your practice, yes or no? So it looks like the results are, wow, that's pretty amazing. 76% of you have seen cases of abuse, of suspected abuse. We're going to talk more about the statistics on that. So anyone can be an abuser, meaning that it can be a man or a woman, a child. There's no socioeconomic class. They can come from all different professions. They can also be long-term clients regardless of their history with you. There's things that change in their life that can make it more, make the animal more susceptible to abuse. It could be new relationships, it can be frustrations in life. And then hoarders, we know that there's predisposing factors that make them more prone to start hoarding animals, right? Which we're not going to go to in this series, but we're going to talk about some warning signs. One of the hang-ups I see with veterinarians is that we don't understand why, and we don't need to know why to know that it occurs. But there is some information that you should know that you about the link of abuse to other types of crimes. So statistics show that animal abusers are 5 times more likely to commit violent crimes. They are 4 times more likely to commit property crimes and 3 times more likely to have drug-related offenses. 70% of people who commit animal abuse have committed at least one other crime. 40% have committed violent crimes. And then in studies with women from domestic violence shelters, 74% of those with pets reported animal abuse in those homes. 88% of families with reported child abuse that had pets also reported animal abuse. So it has a huge link to what's going on in society and the risk of offense and future offenders to humans. We've all probably heard about the serial killer homicidal triad, and there's been recent research that about this as far as whether or not all 3 things are present in their history, which is arson, animal abuse, and prolonged bedwetting. And when they've done the studies, the one thing that they still know, if they didn't have the arson in the history and didn't have the bedwetting, the animal abuse was the one thing that was still in their history. So we've heard about Ted Bundy, Jeffrey Dahmer, and the Green River Killer, Gary Ridgway, and they all had these key elements in their history. And so we know that even though it doesn't mean that everybody abuses animals, especially in childhood, will become a serial killer, every serial killer definitely has this animal abuse in their history. And it doesn't necessarily mean that this is something that occurs when they're young and it's later that they're committing offenses towards humans. It can be immediately. There's several cases where they were within 2 or 3 weeks. There was a famous serial killer here in Texas, Jason Eric Massey, who was pulled over for a traffic violation when he was 19 with a dead cat in the back of his car, and within 3 weeks he abducted a girl and her brother and brutally murdered and dismembered them. So it was all within weeks of being found with a dead cat, and then they found that he had been killing animals and collecting those as trophies. So it's a huge issue. We should consider it an indicator of other problems in the dysfunctional and violent households, right? This one's from Phil Arkow. Domestic violence, child abuse, and elder abuse are definitely linked with animal abuse. There was a study in 2012, released in 2012 from New Zealand, that had surveyed women in domestic violence shelters and found that it was approximately 20-25% reported being forced to witness or participate in sexual abuse of animals. So this is a huge issue. Elder abuse can be hidden and underreported. Neglect is most common, and we often find neglect of the animals in those homes. there is an issue with these cases that we need animal shelter options, because most of the shelters for those fleeing domestic violence don't allow animals. Now we're seeing programs change, safe haven type programs develop in the different jurisdictions, and then there can be an option of a community response where if there's not an animal shelter that takes in animals for domestic violence victims, then there was in Ohio and in Indiana, I believe it was, that there was a group of veterinarians in the city that became a part of the solution. They also did this in New Zealand, where they became they developed a list of veterinary hospitals that were willing to take in and care for, including the medical issues, these animals, and it was on a rotating basis. And if they didn't have room, they just go next on the list. So that's something to consider doing in your area. And we do need cross-reporting with the domestic violence and advocates in those organizations in your area. You can work with them as far as the law enforcement agencies in cross-reporting. When they go out on an animal cruelty case and we have a child that needs to be reported, the same thing. They go out on a child or domestic violence case or an elder abuse case and there's animals in there, then that needs to be cross-reported. So why do they abuse animals? It's to demonstrate and confirm power and control over the family, to isolate the victim and the child or the children, to eliminate competition for attention, that's a big one. Force the family to keep the violence a secret, and to teach submission. And the call out on this photo here, that's tricky. She was my first domestic violence abuse case. The boyfriend shot her in the spine and paralyzed her. So a call out to her, because she went to live at a cageless pet shelter in Marietta, Georgia, and she actually just passed away 2 days ago. So the other thing, other reasons for why they abuse is in domestic violence is to retaliate for acts of independence and self-determination, perpetuate the context of horror, prevent the victim from leaving or coerce them to return, degrading the victim through involvement in abuse and punishment for leaving, right? I think this is interesting and it's disturbing, but this was very interesting comments by women living in domestic violence shelters of things, what they said about their abuser is that he killed the ferret just to scare us. He beheaded the parakeet because she was singing. It amused him to torture the cats. Because I was getting home late, he put my cat in the microwave, and I went back because he mailed me the ears of my dog he had cut off. So this is a significant issue when the statistics are so high about domestic violence. So there was a study in Wisconsin that revealed that in 4 out of 5 cases, the abusive partners had also been violent towards their pets or livestock. There was a New Jersey study that was the 88% of the families where they had physical abuse to the children. 2/3 of the animal abuse was by the father of the children, and the remaining 1/3 were by the children that were being abused. And that's really important to note. And one thing I don't think I have it in here, but statistics show that 1 in 4 women have been or are currently in a domestic violence situation. So that's something to consider when you think about your clients, when you think about your staff, when you think about your coworkers. Juvenile crimes are, as Margaret Mead most put it, one of the most dangerous things that can happen to a child is to kill or torture an animal and get away with it. Right? These are times for action. And I think at least everybody in the U.S. and those outside have probably seen, you know, when we're looking at these recent, in the last few years, the violent crimes, and even going back to the Colorado shootings that they had from these young adults, these juveniles, had this history of being abusive to animals and people not stepping up and doing something about it then. Studies show that on a survey of sexual homicide perpetrators, 36% of the offenders abused animals as children, 46% abused animals as adolescents, and 35% abused animals as adults. And then 1/3 of abused mothers reported their child for animal abuse. Really startling statistics. Okay, so when you're looking at recognition and documentation, we're going to go through, but it's about having the mindset and recognizing where it could come from, because we don't get up to go to work every day thinking we might see abuse, right? But it needs to be on that rule out list. So the animals at risk for abuse, and some studies have shown that it's dogs and cats less than 2 years of age. The younger animals, they're harder to manage, they can be more aggravating and destructive. So that's not only a risk from owners, but if they're outside unattended, it can be from neighbors. So barking, going in there, tearing up their yards. Older animals are not as at risk. And so the question there becomes, is the human-animal bond working? Now, exceptions may be if someone has an older animal and then they get into a relationship where there's domestic violence. Male dogs, they found, especially intact male dogs, are more at risk because more aggressive is the theory and preferred by violent offenders. A study in the UK revealed that the Staffordshire Bull Terrier, those kind of cross or mixed breeds are more at risk. Feline cruelty, I want us to spend some time about, because there's a big difference on the abuse they suffer and the outcomes than what you see with dogs, right? So there's a big difference. Anybody's got dogs and cats knows the cat gets the big bed. Cats have a greater likelihood of death than abused dogs, and this includes hoarding, right? So it's more like on the 70–80% more likely to die than dogs when through abuse. They also tend to have a greater variety of cruelty inflicted, so there could be multiple methods used: blunt force trauma and hanging, blunt force trauma and maybe burns. So when you're looking at these cases, consider there can be multiple types of abuse. They are the most frequent target of all abuse types. So that includes the burning, fractures, torture, beating, mutilation, suffocation, drowning, thrown, which is generally from a great height, also with poisonings, intentional poisonings. A study in Brazil from some friends of mine down in Sao Paulo, they had 644 cats presented for necropsy in a retrospective study, and 30% of those had trauma, fractures, organ rupture from blunt force trauma, and then they have an issue there with carbamate poisoning. The average age of the cats in the study was 2 years, but it ranged from 1 to 12, with 63% being 1 to 2 years of age. They also found that they were, versus dogs, they were 3 times more likely to be poisoned with that carbamate. And why are cats targets for cruelty? Well, the study that was done found of 2 different penitentiaries and looking at 84 prisoners, they found that cats were victims of the greatest variety of abuse, with 33 different forms of abuse being inflicted. They have smaller bodies, so excuse me, they can be harder to catch. And I always bring that up when I'm dealing with cases with cats, is like, how did they get them, right? It's, how did they entice them to come to them? How did they grab them? Or did they use a slip noose or a leash? Cats are more resilient as far as from breaking bones, so they may survive longer, that they can be versus, and this isn't correct, their bones are more easily broken. It's not necessarily true with cats versus dogs. They're actually less easily broken. So there's the I hate cats attitude versus real men love cats attitude. For some reason there seems to be this attitude, which I believe I see is changing, that machismo that's traditionally associated with dogs, the power and control that they're not able to affect with cats that they can feel like they have over dogs, that can lead to an escalating violence and frustration and need to dominate. And then jealousy, as we mentioned, can be, especially in domestic violence or juveniles. Neglected children can turn on the animals that they feel like are getting all the love and attention. Cruelty to cats is underreported and underrecognized. They tend to take off, right? So if they take off and die, their bodies may not be found. So that's one of the problems that we have. Their natural response to fear or injury is this tremendous flight response. They tend to hide, and then when they go away, they tend to go away for a long time and may never come back. They naturally hide signs and symptoms, so it can be undetected by the owner. And then they're naturally inquisitive, especially those that are well socialized, so that can make them more vulnerable to cruelty. Outdoor cats are much more at risk of abuse than indoor. This comes from perception of being a nuisance. They're more prone to being shot. Items can be thrown at them. The intentional poisoning that I mentioned, drowning, hanging, and then juveniles abusing the animal, and then anything that's opportunistic with the cat being outside. Indoor cats are more susceptible for abuse as a juvenile perpetrating the abuse, domestic violence associated with child abuse, elder abuse, physical abuse, and neglect. Okay. So now thinking about non-accidental injury. Your index of suspicion should go up when the exam findings are not supported by the history that's been provided, the investigation information that's been provided, crime scene findings, the environment or the husbandry, how the animal's been kept. When that doesn't fit, your index of suspicion should go up. Right? So context is key, which is we're going to talk more about. Getting information is critical. You need to compare known findings in what you know is found in known accidental causes of injury and natural causes of disease or injury or death. So non-accidental injury should always be on your rule-out list. This is what we need to change. We need to consider, you know, especially when we're thinking of zebras, but we should always consider non-accidental injury. Because we don't go to work thinking about animal abuse, that we're going to see it today, whenever you have a red flag, you need to pay attention to it, because there's a lot of things, maybe even subconsciously, that are feeding in to your processing that you may not even be completely aware of. So if you start to have a suspicion or you see a red flag, then don't just discount it. You need to work it through. Suspicion can be raised by a number of things, and it's not one single thing necessarily unless they admit to doing it, but it can be a combination of things, a combination of your exam findings, things they're telling you, the person is telling you, and their behavior. So the behavior of the owner can be can raise your suspicious indicators. Declining treatment or a necropsy, and it doesn't mean declining treatment means they abuse the animal, but if there's a reason that you're suspicious that the animal may have been abused and they don't want to proceed, it may be a domestic violence related thing, or they don't want you to discover something maybe on necropsy. So if I have a strong suspicious indicator, then if they don't want to pay for treatment or the necropsy, then I may offer to do it no charge and see what the response is, right? Regardless, if I will always hold the body to do a necropsy and report it once I suspect abuse. So we'll come back to that later, but you don't just get rid of the body or let the body go if you suspect abuse. The behavior of the animal can be a suspicious indicator, such as being abnormal for the situation, unduly subdued may be a sign more of neurologic problem or pain. The extreme fear reactions in the history. When you start to do the exam, or when you get your initial history, do the exam, and then you take more history and they change it, the client is acting nervous or they're changing the history, that can be a suspicious indicator. Doesn't necessarily mean they did something, but it could be they know something happened abusive to the animal. Right? You have to consider the alleged events in context with the animal's age, their breed, whether they're intact or not, and the expected behavior of the animal in response to those events. Context, again, is key. So again, it's often a combination of clues. Indicators can be the most pathognomonic feature of physical abuse is repetitive injuries. Seeing injuries in multiple stages of healing or in their medical history, you're seeing this coming in for repetitive issues can be an indicator. Unexplained symptoms or injuries, similar injuries on other animals, unexplained deaths or disappearances, right? There may be under the client file a list of animals in the same home that have only been seen once at a vet. The animals that don't live very long, or they always run away, and then they get a new young animal, so they're not surviving past 1 or 2 years of age. Those can all be indicators. So I want to take a moment and talk about bias. Because once you attend lectures about forensics and animal cruelty and suspicious indicators, you can also swing too far the other way, thinking everything's abuse. So it's important to remain objective and to guard against developing bias. So there's things to consider in your thought process and your analysis to try to remain objective. We tend to use mental shortcuts, heuristic thinking with information overload. So in the middle of a practice, you're running behind, you've got surgeries, you've got phone calls, it's Friday afternoon, 5 o'clock, and you have to be somewhere that night. There's information overload and a lot of stress, so we tend to use shortcuts, and we need to take a moment and be aware of those things and really think through. Right? We tend to naturally prefer less complex. We want it simple. Okay? We may tend to have a belief that we tend to want to believe the witness accounts versus considering they're not always telling the truth, or they're telling part of the truth. Most of the time they're telling you part of what happened. Right? So there's elements of truth throughout. And then we tend to have confirmation bias, right? Where we want to believe that abuse happened, or we want to believe it didn't happen, right? So we want to believe positive versus negative. And so when we want to do that confirmation bias where we're proceeding, where we're trying to confirm what we're thinking or what our preliminary judgment is, then you're going to give less weight to the opposite information, right? So that balance becomes an issue. And then there's an anchor effect that can happen where we rely heavily on just one piece of information, and it's usually the first information encountered. So when I have a sergeant that presents to me a cat, a deceased cat, saying, and he's got the badge and the gun on his belt, and he says, I know that these group of kids killed this cat. I'm going back to draft up their arrest warrant and let me know what your necropsy findings are. The tendency is to want to prove that the cat was abused and died. So you want to always remain objective, right? So this is the conducting your investigation, your examination to confirm is not the best way to go, right? So You want to maintain your objectivity, and if what you find supports your theory or your thoughts or your analysis of what happened, then fine, but you want to have that balance. And so when you're conducting an investigation in confirming manner, then you will consider less, pay less attention, and give less consideration of all information. All right, so you've got to put against this. So things that you can do is review all the information several times. Consider alternate theories and seek to disprove or support each theory as you're going along. And make sure that you document all negative evidence, things that aren't found or things that don't support that. And then I find it always helpful, one, when I'm doing an examination, especially in necropsy, to have the investigator there, whether it's an officer or an animal control officer or law enforcement, sometimes even the attorney being there. That helps because you're talking it through as you conduct the examination. And then consider discussion with your peers, with another veterinarian, whether, you can call me or anybody who you can just bounce ideas off of, right? And this is how you develop relationships and teams on the animal cruelty investigation. Excuse me. All right, so abuse in the veterinary practice setting. The most common type of cruelty that you will see in the veterinary practice is neglect. Right? And there's a lot of gray areas there. The most common source of physical abuse that you will see in practice will be domestic violence related. The type of abuse that's most commonly missed by veterinarians is sexual abuse, which is way more common than you think. The cause of blunt force trauma is commonly missed. So the interpretation of the injuries can be overinterpreted or underinterpreted. The most common failures by veterinarians is not reporting suspected abuse, failure to document, and failure to photograph. Suspicion on physical abuse, things that you can see. This isn't a complete list, just to get you thinking, is unexplained swellings on the animal, whether it's historical or during your exam, unexplained lameness, injuries, bruising, neurological signs, especially those that are self-resolving and repetitive. Hidden injuries are common with physical abuse, so it can be healed fractures, especially the ribs. So you need to think about that when you're examining an animal. So you may find hard callus while you're examining the thorax. Radiographs, that may be the only way to reveal these. Petechia or hemorrhage in the eyes can be seen in the ear canals or in the pinna, right? Which we're not going to go through, but it's also in the blunt force trauma lectures on Vetfolio. So the other is injuries to the nails, frayed nails. That can be, especially in cats, that is indicating frantic movement. So an indoor cat with frayed nails is not normal, right? Not typically normal. Injuries to the tail, depending on the location. Distal tail injury on a cat or even a dog, accidental closure in a door or accidentally stepped on, when it's more proximal, then you got to be thinking something else. Right? Fractures, the type of the fracture, remember what you were taught in vet school. Think about the type of fracture, the forces required to cause that type of fracture when it doesn't match the history provided, the investigation findings, or the husbandry, how the animal's kept. In domestic violence, suspicion can be from the client behavior. The client has injuries, visible injuries, the child may or may not have injuries, and history taking can provide clues. Physical and emotional abuse of the animal, when you're seeing signs of that, and there is a huge range of potential injuries. A lot of times they're repetitive injuries, healed injuries. These can be very subtle and hard to detect because they don't want to get caught. And oftentimes the person bringing them in may be the victim of abuse in a domestic violence situation, and the perpetrator, the abuser, doesn't even know they brought the animal in, right? Neglect, it can be just from a client, it can be associated with hoarders, it can be associated with animal rescue groups that have turned into a hoarding situation. And I get questions about this all the time. I'm going to give some case examples, but non-compliance, when they're not caring for their animal as you've instructed them to do, this is a gray area for veterinarians, because you need to really delve down is why are we getting non-compliance? What is the issue? And it needs to be documented. Is it a failure in communication and understanding? Is it a finance issue? So sometimes these, when they are not complying and the animal is suffering and you are not able to mitigate the suffering or to treat that, that's when you have to make the decision about reporting. And then if you have any questions, that's when you call the person investigating abuse and talk to them about it, right? So the documentation of all your communication and the issues in the animal and what you've told the client and that they understand it is important to record in the records and have them sign that medical plan. So continued failure after that point, it should be reported. In sexual abuse, suspicious indicators can be associated with unexplained medical issues or trauma involving any of the genitalia or the anorectal areas, bruising in the genitalia and the perianal area where they've grabbed the animal or restrained areas, so that can be in the thighs, the lateral ventral abdomen, the medial thighs often is an unusual bruising presentation. Generally, that can be associated with sexual abuse, the caudal chest, the neck, the muzzle, the ears from where they've grabbed or restrained them. Unexplained chronic refractory vaginitis, rectal bleeding, unexplained rectal or vaginal prolapses, strictures, anal strictures, proximal tail injury or flaccid tail from those from sexual abuse. It can be associated with sexual abuse of the animal, and abnormal behavior or abnormal reflexes during the exam. So hyperarousal of the animal, the extreme anal protection, anal sphincter reflexes can be a suspicious indicator. In dogfighting, the typical pattern, scar, and wound pattern associated with dogfighting, a request for a severe ear crop down to the head, down to the level of the head, or a really short ear crop can be should be suspicion that maybe they're going to use the dog for something along the lines of dogfighting. Evidence of a home-done ear crop can be associated with dogfighting. Osteomyelitis, fractures associated with bite wounds or punctures or scars, and you can see these on the legs, the joints, and the muscle of the dog. Injuries to the face, the eyes, the ears, the lips. They will typically, these dogs are intact. Not that intact alone means dogfighting, but they're usually not spayed or neutered. You can also, based on how they're housing these dogs, you can see sores or calluses, pressure from laying on hard dirt or concrete environments. So that can be the contact points of the pelvis and the legs, elbows, and so forth. Other suspicious indicators: poisoning, intentional versus accidental. You need to think those situations through. Exposure, I mentioned earlier, to illegal substances. The issue is an endangerment to the animal. Behavioral indicators, more studies are being conducted, but there's a lot of variables in that, but publications have been forthcoming on that. The behavior can provide a clue that may be consistent with abuse, but it also could be explained for other reasons. And then extreme fear reactions. I had a lady bring me a cat that for a behavior consult, and said that every time her boyfriend walked in the room, the cat froze, screamed, squatted, urinated, and defecated, and then ran out of the room. So by the end of the exam, that's an extreme fear of death, extreme fear reaction. So by the time I was done with the exam and talking with the young woman, she broke down crying and asked me, I provided her solutions in areas where she could go for domestic violence, and because she admitted that she felt that the boyfriend was abusive to her cat and admitted to her. She asked me if I could keep the cat because she didn't feel like she could protect it. All right. So Munchausen by proxy. I just want to mention this because I think this happens, and again, we miss it. So real quick about that, it's an abusive syndrome that's perpetrated on children. And it's after a man who was a teller of exaggerated lies and then later became addicted to that attention from lying. So it's characterized by adults providing falsification of an illness and a proxy. All right. So in this case, I'm talking about an animal versus a child. And they do this to deceive the medical professionals so they believe the animal is ill, right? Which leads to hospitalization, testing, and treatment. The motive is to gain sympathy and attention. The warning signs in children can be sudden death or an unusual illness of the family pet. So they try it out, right, on the animals. In animals, when the symptoms or signs are deliberately produced, the owner initially denies falsifying or causing, and the symptoms, this is the key, when the symptoms are reduced or resolved when they are separated from the owner. All right. So, and then other signs associated with this is the pet is taken repetitively to the doctor for medical assessment and treatment and insisting on unnecessary procedures. And I'll bet you probably 100% of you have had a client like this, right? So there's 3 stages of falsifying an illness. The first is they just provide the story, false illness story alone, which may cause unnecessary tests and treatments. And then there's a second stage where they fabricate signs, so they may try to manipulate records or tamper with samples if they're left alone in the area. And then the third stage is they will induce an illness by causing physical harm to the animal, to the proxy. So you can see really bizarre, complex symptoms making detection difficult. They may present as very caring, nurturing, and find great satisfaction when the animal is hospitalized. They're often very calm, abnormally calm, when informed of unusual symptoms and test results. They want tests done and tend to be very involved with the care and treatment, which in and of itself isn't necessarily an issue because we want clients to be compliant and want the best for their animal. But it's all these other things, right? They may excessively praise the staff. They may have a medical background and seem knowledgeable about the pet's illness, like they've researched it. Symptoms can be anything depending on what was used to induce the illness. It can be bizarre test results that I mentioned that don't fit the clinical picture, or contradictory results, or things that has never been reported in the literature. Things they may do is suffocate the proxy and then try to revive them. So again, it's that attention seeking. And then you may see they try to do deliberate poisoning, and the sources can be veterinary drugs, human drugs, chemicals, salt was reported in one. They may interfere with equipment. So this is really interesting if you leave them alone with the animal if they're visiting or even in the exam room. They inject substances under the skin. They may shop around for doctors. And the biggest sign, like I said, is resolution of signs when the animal's removed from the owner. And the perpetrator may not be the client, the owner. It may be someone else in the home and not the presenting caregiver. These animals tend to have high morbidity and mortality, high re-abuse scenarios, possible serial animal involvement. So as I mentioned, it's important to supervise if you have these suspicions, their visitation with the patient, and discuss with the owner. When you're discussing things with the owner, you want to emphasize the welfare of the animal and the possible fatal outcome unless the doctor unless you know what was done to the animal. That's where you can start to hopefully get more information. The caregiver or the owner may seize an opportunity to abuse and induce symptoms while they're in the exam room or they're hospitalized. And so when you think that, look at where they may have dumped the evidence. So it may be in the trash can, the sharps container. Think about IV lines, catheters, all the medications that they could have had access to in that area. Think about the food and water in the cage, if the animal vomited, and think about testing for that or any urine or feces. All right. So poll question 2. So very interesting, 65%. So the poll question now, after hearing all this information, how many of you think you have seen suspected case of abuse but did not recognize it? So 65%. So that's good. So now things will change. All right. I want to mention real quick that Lorna had mentioned in the introduction about the second edition of the Veterinary Forensic book. The forms we're going to talk about are in the textbook, which is also an ebook, so you can download them. They're also available on my website, which I'll give you on the last slide. A lot of them, not all of them, that you can download and edit and do, as long as they didn't say they were copyrighted and it's a different author that put the form on the website. So there's also forms, and we're going to talk about these intake forms that are critical for your documentation. Exam forms and diagrams, these are really important. They help channel your examination. Chain of custody, evidence logs, and then a photo log. All of that is available on the website. So when you are presented with a case of abuse, and oftentimes, I mean, this could be also from a client, but typically this is where law enforcement or an investigating agency has brought you an animal. It's important to get key information, and we tend to forget about this. So I usually had my assistants, my technicians, definitely make sure we got all the information, because you're also going to be asked about this later on. Who brought the animal in? Get their contact information, the agency they're coming from, the date and time of arrival. Right? They're going to ask you that potentially later. Get the information about the animal, the species, the breed, if all this stuff, age, if it's known. Where did the animal come from? Was it a stray, abandoned? Was it seized from an owner? Was it relinquished? The cruelty that's suspected, any investigation findings, and if the officer has a report, get a copy of it. At least get write down verbally what they know or suspect has happened, anything confirmed and suspected. If you know the animals, if there's any medical history that's been provided, if hopefully they've given you, if not, they need to get it to you, any photos or videos taken of the animal, the scene, and they should also have a chain of custody form when they're turning over a live animal or a deceased animal. So you want to, that's to remind you there that it needs to be signed, and if not, get your chain of custody form out. The date and location the animal was removed from or found, right? So that information, and then this is a key aspect. Ask them, what was the animal's demeanor at the scene? And then any changes in the animal's demeanor since they have picked up the animal and brought it to you, all right? Because this is key. because we know just the adrenaline rush, or maybe they fed the animal, you want to ask about that, water, anything given to the animal, that can change everything by the time the animal walks in your hospital. You also want to find information about the environment. Was it indoor or outdoor? Was the animal indoor or outdoor? Do they know the weather conditions? Did they get the temperature? Again, food or water there at the scene, and also if they gave any en route or prior to bringing the animal to you, or if they were housing the animal, if there was any feces or if the animal urinated. The housing conditions, the type of shelter, and if the animal was confined in-house. So get that information. Ask them about the cleanliness. You want to know what the animal was living in, right? Were there other animals there? If so, what kind, how many, what was that situation? And then a description of the scene and anything found at that scene. So that includes any evidence, physical, biological evidence, suspected weapons, blood stains, etc. All right, so this is for you to get all that information. And then there's a deceased animal intake questionnaire, which is very similar to the live animal, except going down to the bottom, we're looking at how was the animal's body held prior to them bringing it to you? Was it in refrigeration? Was it frozen? Was it at held at room temperature, and then the date and time of holding. And if they've attended the right lectures, they should also have temperatures that they've recorded of the holding area if in case there's insect evidence, right? And then if the animal was initially alive, you want to get that information. What were the observations, the demeanor, the exam findings, and any medical history. It's the same information, again, about the environment, the housing conditions, other animals, and scene findings, scene description. All right, so when we're looking at evidence and documenting evidence, you want to consider what is it, what function did it serve, what relationship did it have to other items of evidence found at the scene or the animal. How did it relate? How does it relate to the scene, the victim, or the suspect? And how is it part of the criminal event, right? Admission of evidence and the analysis and admission of the analysis results of evidence is governed by rules of chain of custody, because once evidence has been moved or altered, it can never be recreated. So the documentation is critical. The context of evidence is important for the interpretation of analysis or of what that evidence means and the weight that you give it, whether it's on evidence found on the animal at the scene or the animal itself. Right? Chain of custody starts with the documentation, the collection, the packaging, the transport, testing. It's documenting everything that happens to that evidence and who came in contact with it. When you're looking at testing and collection of evidence, you want to consider any potential impact of a time delay that it might have on that evidence if you wait to collect it or wait to test it, and if that could alter the outcome. So chain of custody refers to the chronological documentation which shows the seizure of that evidence, the collection, the custody, the control, the transfer, analysis, and disposition of an item of evidence. Evidence is anything from a crime scene or the animal, samples collected, including your blood, your urine, everything, photos, radiographs, and the body of the live or deceased animal is evidence. Right? Proper packaging and labeling is required, and you need a secure storage area to keep your evidence. The chain of custody, you're documenting every person who comes into contact with that evidence. So this chain of custody includes the when, the why, and how the item was handled, any changes made to the item of evidence during handling, any testing conducted on the evidence. And what this does is proves the evidence submitted in court is the same as the evidence collected. It's the same. Right? So you do this by maintaining an evidence chain of custody log. So you assign an item number to each item of evidence collected. This is a unique number to each item of evidence. It's usually assigned by the order in which it's collected. So 1, 2, 3, 4, 5. Then you want to give a description that is specific to that item and so that it can be identified from all other items collected. Right? So a unique description. Here's an example, and there's a ton of them out there. You can make your own. You can get some from your local law enforcement agency. I'm sure they have them. But they all have these key things. The agency, the case number, the evidence holding location and the heading, and then the evidence listing. So the number, the evidence description, the date it's been collected, the initials of the person collecting the evidence, right? So this is the log, right? And then if that item is removed from the holding location, the purpose for reason the reason it's been removed and for what purpose, and it tests if any that were performed. At the bottom is your chain of custody, and this is where you list the item. So if you remove an item of evidence and you're going to transfer it to another person or a lab, so it's going to some place or someone else, you list the item ID, the date it's removed, by whom, and then the receipt date, who received it, and by whom, and they sign it, right? So what you do is you don't send your original evidence log, you would make a copy of it, and then have that person or lab or whatever sign off when it's been removed, and just show receipt. Photography, you want to start with general photos of the entire body with the case number, animal ID, and date to start the series on the photo card. You may start with just a photo of the information regarding the case. So like in the bottom right, it's just the agency, the case number, the date, and the animal ID. And you want to make sure that your photo card, before you use it, is clear of prior images, right? So you can do it with a dry erase board with the animal. Right, so that starts your series, and then everything after that belongs to that animal. You want to start with a minimum identifying photo, so a minimum of 5 views, which can be more than 5 photos, that clearly shows all of the animal, their front, both sides, their top, the dorsal aspect, the rear, and maybe the ventral. It depends on the animal. It depends on if you can lift them up and they're alive. But you want to show unique markings as well. Make sure that pictures are clear, the lighting is good, but you never, ever, ever delete a photo. Regardless of how bad it is, you always want to keep it. Right? It'll show up in the metadata there was a deletion, and you'll have to explain why, which for the opposing side could mean there was an exculpatory photo, so you just never do that. You can always alter the photos later after you download them. You can copy a photo and then alter it, enlarge it, put diagrams in it, as long as you keep the original. You want to take a series of context photos starting with the distant, then mid-range, and then close-up photo of the area of interest. This shows you context. It's not always possible, but you always want to try to take photos at 90 degrees, especially when the size and shape matters. And then you want to take photos with and without photo scales. This is physical evidence or exam findings such as wounds, and you use a photo scale when the size and shape matters. So here's an examples of all different types of photo scales. Really recommend that you get the ABFO number 2. These are not expensive, but that scale in the top left has a grayscale and a circle, a grayscale for color, and then the circles for correction of 90 degrees versus distortion. If you don't have scales of a true photo scale, you can use rulers. You can use anything that has a known size. So coins, dollar bills, and then you can go to evidence supply companies and order kits. CSIGizmos.com has things you can download and make your own scales and print those out. So here's an example. So again, you want to show the photo scale should be in the plane of the area of interest. So the top left, that's fine if you're looking to do this area to the left, but if it's in the center of the L of that bracket, then you're just taking a photo scale of air. So make sure it's in the same plane. So it's just different photo scales that can be used and how they can be used. You can use small labels and arrows, download those arrows for close-ups if needed. You don't want to use your fingers. You can also use something else to point at something like a cotton tip applicator. You want to take photos before and after treatment when the evidence changes, so after you shave something or when the animal improves or gets worse. right? One mistake I commonly see made is not taking photographs of all sides of the legs, especially in dogfighting cases. This is to show the scars and injuries on all sides of the legs. You want to download the photos in the original sequence taken and then organize them in separate folder. If you're doing a multi-animal case, you can organize them in separate subfolders by copying them. Don't move them, keep them in their original sequence, and then you can copy them into subfolders with the animal ID as the label. You want to, if you scan, you should be scanning for a microchip and then photograph it if the animal has a microchip. If you receive an animal or receive evidence, you want to show that chain of custody is intact. So you start with external packaging, so before the box is open, showing the label, and then photograph as you open and remove each layer of packaging. Then you want to keep a photo log. And this photo log can be kept while you're taking photos, or it can be done afterwards. So this is to show what your photos are of. So it could be 1 through 10 external views of the dog, 11 through 12 bite wounds on the face. Just a general quick description. If you take your photographs correctly by using distant, mid-range, then close-up, then you can later look at those photos and know exactly what you took them of. Right? You never just want to take a close-up. If you do make the mistake and take a close-up, then back up, keep going, take a distant, mid-range, and close-up again. So then you fill out this photo log, and a copy of this would go to the investigator and or prosecutor. Videography is important to consider when it is important to capture behavior, sounds, neurologic signs, abnormal movement, especially in neglect or starvation cases when you want to document when the animal is first given food or water that they would eat, and especially if they are voracious about that food or water. Again, you want to start the image with the case information like you do with photography, and then if you don't have a mute button, which I highly recommend that you figure out how to do it so that you can push it when needed, when you don't need sounds from the animal. But when you're doing recording, make sure it's a controlled environment if you can, and make sure everybody's aware that you're recording and that they do not make inappropriate comments. The behavior of an animal, I mentioned it's important to ask that from the investigator when it first presented. You also want to note the activity level of the animal, their interaction with people and animals, any fear, anxiety, or distress to certain stimuli, people, items, sounds, smells, indicators of pain, because every animal can be different. Consider what the behavior response would have been to that alleged abuse, actions, or neglect, so the alleged events, and then discuss the findings and observations with investigators. And I strongly recommend, especially in certain cases, that you consider potentially a behaviorist to analyze for emotional distress. All right, prep for the exam real quick is that remember the animal is part of the crime scene, and you need to anticipate and prepare for this documentation and evidence collection. As long as the animal, it's not endangering the animal's health and welfare, is that you want to try to avoid initiating treatment, any treatment that can compromise evidence, such as cleaning, shaving. Consider how to avoid contamination of evidence or transfer of evidence from you to the animal. So thing about having, especially in certain types of cases like a sexual abuse, you need a clean area for just handling your evidence and packaging it. When you're doing the exam of the animal, you want to document all findings and avoid leaving blanks on the forms. You want to use not NA for not applicable or strike through and initial it. When you're aging an animal, only put the animal's age if you know it. If you've been given documentation or verbal information, and note how it was provided to you. Otherwise, you want to give an estimate of the age and the basis for the age. You can be extremely wrong on aging of animals, and you don't want that to be used against you to undermine your credibility later in court. So juvenile aging based on dentition or young adult, geriatric, along those lines is safer. The breed, only if it's provided, or if breed type, is preferred, and that way you're covered. Medical history, you want to consider that for information, and record your general impressions of the animal, their consciousness, their posture, their locomotion, strength, the shape of their body, nutritional condition. Give a body condition score and note the scale that you used, any abnormal sounds or other abnormalities. So there's different forms out there and available, and again, these are going to be on the website and associated with the textbook as well, and they're Word documents so you can change them. They also correspond to the forensic report template. So if you alter those, I recommend that doing your exam, your necropsy or live exam forms the same as the format for your report, because it's going to be easier to follow, easier to create, and it structures your thinking, right? So case information at the top, your name, the date of the exam, the time you start and finish, and that's also for billing later, which we'll talk about next week. The method of arrival, the materials provided and reviewed, really critical to put in here because you're going to be asked about that in court. What was provided to you, and did you review it when making your analysis and your conclusions? Any crime scene or forensic findings, whether or not you were there or it was told to you verbally. All right, sometimes on the phone, sometimes they're there, sometimes it's a report, and then you start with your exam findings. Okay, I put the body condition score on there, and then it just goes all the way through. Right. Again, I've shortened this for the presentation, but on the actual template, there's a lot more spaces for you to write your findings in all of these areas. So it works you through the external exam, if there's been prior medical or surgical intervention, radiograph interpretation if that was done, and then you list any samples, evidence collected, and any testing that was done. The necropsy exam form is basically the same form, except there's going to be the route of delivery of the animal and then how the packaging of the animal. Right? So they're usually in bags, or they may be in a body bag, plastic bags, a styrofoam cooler. So you want to describe that and take photos. And then it changes, of course. You've got your external exam, which we look at decomposition levels, any entomology evidence, your recording rigor, lividity if it's present, and it goes all the way down. This is all external exam, same body regions, and then radiographs. And then on internal exam, it starts with skin reflection findings. So anything in the different areas of the body, that's actually usually a large section, and then it goes by regions, head, thoracic cavity, abdominal cavity, and then the systems, samples collected, and then additional comments. Other forms to consider using is that have diagrams is there's the skin, hair, coat, and nails where you can diagram injuries or findings. So you can do that. There's dog and cat ones. Then there's skeletal lesion forms then for dogs and cats. So if this helps with documenting what you're seeing on radiographs or a necropsy, you can helps you give a visual that could be used possibly as an exhibit in court or later or in your report. So this is just showing it with dogs and with cat, the skeletal lesion with dogs, and you can make your own. Additional forms, there's the website veterinaryforensics.com. There's forms for dog fighting. This is a scar and wound chart that's only to document scars and wounds related to fighting, not everything you find on the skin. Same thing, there's a cockfighting form. There's also special evidence forms provided by some of the authors, an entomology form and botany form for collecting those types of evidence. There's a guideline for collecting fixed tissue from pathologists, and then create your own that will work for the best for you. I want to mention that the Vetfolio forensic certificate courses, this is on vetfolio.com, that has a series of certificate courses, 4 different courses in veterinary forensic science and medicine, and then 2 in animal crime scene investigation. So I highly recommend that you look at those. They cover dogs and cats, and as well as a variety of other species. Course 4 in the veterinary forensic science one is purely non-dog and cat species. So we tried to structure these courses to answer everything that you've always wanted, or we felt that you needed to know. This was a group of veterinarians and prosecutors and law enforcement thinking about what does the team need to know, from law enforcement to veterinarians to prosecutors, and these are the topics we came up with. So I encourage you to take a look at those. That will help you to be better prepared to deal with these cases. All right, so now we're going to go to questions, and I'm going to put here my contact information.
That's great. Thank you so much, Dr. Merck. Can you hear me okay?
I can.
Great. Thank you so much. The information was really, really interesting. A lot to think about. We do have a couple of questions. We were wondering about how common is Munchausen syndrome, and are there some good studies on that and good information?
So that it's hard to answer as far as how common it is. All we can do is look at the human studies on children. But I think there's been like one article that's been published. It may have been out of the UK. I think it was touched upon by the Monroe articles in 2001, which was the Battered Pet series that they touched on that. It came up, and once I read about it, I could identify probably 2 clients in my, at that time, like 17 years of practice, that I had a high suspicion. And,
Okay.
and there was just a gut feeling. It was one, I definitely hospitalized the cat, no charge, because I just knew something was going on in that environment, and of course all symptoms went away. Now, and I don't think it was a single woman, so I don't think it was a stressful environment with children running around, or domestic violence, something that was that there was a stress component to it. It truly was when I got the cat out of the house. Of course, this was before I was doing cruelty work, so I don't know how common it is, and it's a gray area because we have clients who are very involved and want everything done, but it was more than that. It was getting some really bizarre stuff, and the description of what she was seeing with the animal wasn't necessarily coinciding with the exam. It didn't fit in anything. Of course, cat medicine could be crazy weird anyways, so it had to be pretty extreme for me to go, oh, something's up. So I really don't know. You'll have to, I apologize, I'll look before the next lecture to see if I have that site. I believe there was one paper besides the Monroe's where it was mentioned. But I found it interesting, though, in the human cases on children, that one of the historical findings, or the common history, was an ill pet, because they would try out things on the family pet before they did it on the child.
Yeah,
So
that was really interesting.
Yeah. So again, I think it's an underreported. And when I mentioned, I forgot, that I would discuss some scenarios about how to handle these different types of cases. When I mentioned later, I meant next Monday, not tonight. So I just want to clarify that we'll go over some examples of how to handle things in the exam rooms.
Okay. Great. So now when you're talking about taking photos and radiographs and all of that, do you need to get the client's permission to do that, or is that something you kind of take the animal in back and just sort of do, or somebody was wondering how you are able to do that without permission?
So there's different laws. Actually, Florida has a law that allows you to do things for the animal without, to render aid or do things without permission if it's urgent. We're going to talk a lot more about that on next Monday when we talk about hospital procedures, but you do separate, there's certain things that you cannot do. You don't want to do anything that would be invasive or jeopardize the health of the animal without the owner's permission. Certainly rendering care or treatment as an emergency basis, that certainly would be okay. Sometimes, you know, if I did x-rays without sedation or something, I might be able to do that because I'm not putting the animal's health in jeopardy, but I'm not necessarily going to charge the owner. You know, it's about charging, and it can become about charging.
Right.
So it's all gray areas. Again, the Veterinary Practice Act, like again, some of the states and provinces have some language in their practice acts or their laws that allow for that. But again, I'll just jump ahead. When it's urgent, you also can have an issue where you are going to um, um, get permission from the investigating officer because they're en route. Right, so as soon as you report, you want to get their permission and ask them what you want to do. And ideally, it's better for the investigator to be there, but sometimes I may do things and say, well, going back through, every case was different. I may say, you know what, I've got to bring the animal to the back, blah, 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 and I went ahead, I'm going to go ahead and take some x-rays, but I'm not going to charge you because I need to do some diagnostics to know. And no one ever said no. No one ever said no. And especially, but again, think about those types of cases that you're going to be seeing. Most of them are going to be domestic violence, family violence related, right? And so it's money. You know, they're going to have to explain the bill to the abuser. So why are they saying no, right? Right. So you don't necessarily do a full workup because a lot of times you're going to find things on your exam, right? But if you're really suspicious, I would get permission. If they won't get permission, find out why. If it's money, say no charge. Because if you're right, you're going to get paid later, right? Which we'll talk about also next week.
Okay, all right. And actually, you know what? This would probably be a good time. Do you want to just take a minute maybe just to talk about what you're going to be talking about in the upcoming ones?
Right, so next Monday is talking about a hospital procedure. So it's going to be when you get the case in the hospital, what do you do? What can you do? How are some different ways to handle things, taking a history, and we're going to go through some examples. And then, so it's about developing a standard operating procedure, different types of hospitals, especially emergency hospitals, some considerations, how they might be able to handle these cases better, and then how to work with your staff on them. And then the last, so 2 weeks from tonight, we're going to be doing about the veterinarian's role in legal cases. So we're going to talk about the reports that you have to develop, what is expected of you, the different ways that you could interact with the legal system, including testimony, and yeah.
Okay, great. And some couple of questions are coming in.
Okay.
I just wanted to, people are asking whether or not veterinarians are mandated reporters of child abuse.
Again, next week.
Yeah, okay.
It depends on your jurisdiction.
Yeah, that's what I thought.
Yeah.
I know that, and it's just recent in terms of some states where, you know, veterinarians are mandated reporters of animal abuse. How pitiful that is that. But in most places, we're not even mandated reporters of animal abuse. So I'm sure you'll be having that conversation in the rest of the series.
And then some are required to report dog fighting. I think that's California.
Right.
I think California's one.
That's so interesting. So, okay, well, thank you very much. This is great, and I'm going to wrap us up here, and I want to remind everybody, which I will do in another slide too, that this is just the beginning, so that we hope that you're going to come back for the next couple of Monday evenings so that we can get into even more detail. And thank you, Dr. Merck, so much. This really was wonderful. I want to remind people that in order to get your CE credits, you do need to fill out the surveys, and that we will be sending your CE certificates to you via email. And remember that because this is a series, each part of the series has a separate CE survey. We're kind of sorry about that. I know that that's a little bit of a pain, but the way to do it so that we can give credit for each one of these individually is that you will need to do separate surveys. So thank you for doing that, and when you complete the surveys, again, please feel free to give us ideas about webinars that you would like. So again, this series is going to continue next week, November 9th. Dr. Merck will be talking about hospital procedures, and so we hope to see you there. And remember that our routine regular webinar series is still going on, and that Wednesday, December 16th, we will be doing something different again. We will be doing a webinar in partnership with the Association of Shelter Veterinarians. We're very excited about that, and that topic is going to be win-win, the value of shelter private veterinary practitioner collaborations, and we hope that you'll join us for that too, with Katie Brodus and John Fout, who are from the Association of Shelter Veterinarians. And we just want to remind you that these webinars are going to be recorded, and we have many archived webinars, and so if you missed anything in tonight's webinar, you certainly can listen to the archived version. We'll be putting that up later this week. So thank you everyone for coming. We really appreciate it, and we hope to see you here again next Monday night. Good night, Dr. Merck. Thank you very much.
Good night.